I'd like to thank everyone for joining today. This is a webinar put on by the Gateway to Global Aging Data, which is part of the Center for Economic and Social Research at the University of Southern California. And we're a project that's funded through the National Institute of Aging, one of the parts of the National Institutes of Health here in the United States. I'll say a few things up front just about the webinar and the format. So we're calling this an advanced webinar, and that means that we sort of assume that you might have some familiarity with longitudinal survey data, perhaps with the HRS family of studies, which we'll be using today and that the Gateway focuses on. And perhaps the harmonized data sets, which are produced by the Gateway, which we'll be utilizing as part of the webinar today. A recording of this webinar is also being made, and that'll be made available after the webinar on the Gateway website, which is g2aging.org. And that'll be made available along with the slides from today's webinar and the Stata code that we will be using to kind of go through some sample exercises to look at longitudinal analysis using these data sets. Also, this is a webinar, so we would encourage participation. So if you have any questions along the way, you can ask them using the Q&A button and just pose a question. And depending on the content, myself or Jenny Wilkins, my colleague who's also here with us today, we could answer that question right then, or we'll answer it towards the end. And also at the end, there will be time for question and answer overall. So again, thank you. I hope you find this webinar informative. My plan is that the webinar will run around 45 minutes and we will have some time built in for Q&A towards the end. So briefly, what we plan to do is we're going to do some longitudinal analysis using the HRS, that's the Health and Retirement Study inside of the United States. And we're going to kind of do two different types of estimations and regressions, just different types of analysis. First, some kind of analysis or estimation that we can do when the data are in wide format, and we'll talk about that. And then again, when they're in long format. And then because the Gateway really focuses on these cross-study or cross-national comparisons, we're also going to do some analysis once we have data from both the HRS and one of its sister studies, ELSA, the English Longitudinal Study on Aging, together. And we'll be doing that also in long, the data will be in long format then. So let's start with our research question. Often it's really nice to just kind of start to understand a data set. It's just to pose a research question, and we're going to kind of walk through these data together and how, if this perhaps was your research question, how you might go about starting this analysis. Of course, this is going to be a really high level, very quick overview of different types of both these data, and by no means is this exhaustive about longitudinal data techniques, but hopefully it will give you an idea of some of the challenges that you might face when doing longitudinal data and when using longitudinal data between different studies. So our research question, which we're going to kind of use to motivate us through this webinar, is: are younger cohorts more or less likely to experience disability than older cohorts? And here we mean cohorts generally by birth cohorts. So that's kind of the first question we're going to try to answer. And then we're going to also look at, are the same cohort patterns found in England as in the United States? So we'll start with looking at the United States with the HRS data, and then we can look in England and see if we see a difference between those two in the patterns between cohorts. So the steps for part one, the HRS part of this webinar: we're going to download the RAND HRS and Harmonized HRS. We're going to load those data sets. We're going to identify our relevant variables. We're going to create a few additional variables. We're going to do some analysis while the data are in wide format, and then we'll do some analysis both with prevalence and incidence while the data are in long format. So the first step is just to download the HRS, and the HRS harmonized data. There's actually several different data sets that you can use, which generally don't overlap, but they have different purposes. So the main harmonized data set for the HRS is the RAND HRS, and this is a really user-friendly version of the HRS data that's produced by the RAND Corporation. And by far, it's one of the most popular data sources for the HRS. We'll also use the harmonized HRS dataset. And this is a dataset that's produced by the Gateway. And in particular, it's really built to make sure that the HRS data is easily comparable with other HRS sister studies. Both of these can be downloaded from the HRS data download system. I have that link here. And if you're logged in, then you could see that there's both RAND contributed files and Gateway harmonized data. If you're looking for that link or links to any of the data, I'm going to briefly just switch over to the Gateway website. Again, that's at g2aging.org. And if you click on this Downloads tab here, you can get links for, this is core data. So here is for the HRS and for ELSA. So you can have links to the RAND HRS and the harmonized HRS. You can find these links here. So once you've downloaded those, then let's think about kind of what are the variables we're going to want to use. This is going to be longitudinal, so we're going to look over a couple years or waves at least, and then we can match those to variables inside of the data set. So we're going to look over the years 2002 to 2014, and that's HRS waves 6 through 12. I'm starting at 2002 because 2002 is also the year ELSA started. And I know that eventually we want to bring in ELSA and compare those. So I'm going to keep years which are comparable between different studies, even though the HRS has been fielded since 1992. If I switch back over to the Gateway, one of the helpful tables that we have on the Gateway is on the Surveys at a Glance tab. And you can see how different waves of different studies line up with each other. So for instance, we can see that wave 1 of the HRS was in 1992, and then wave 6 was in 2002, and wave 1 of ELSA was in 2002. And you can go from here, if you're new to the Gateway, and look at all of the survey questionnaire that's part of that wave of that study. But for now, we just want to have waves that are comparable. So we're going to use from the HRS, waves 6 through 12. We're also going to create an indicator of disability. And in this case, we're going to use something really simple. So we're just going to kind of model disability as having any difficulty with activities of daily living. So these are kind of common questions that you can, that are asked in most of these HRS studies. And if you wanted to know more information about what activities of daily living are comparable, using the Gateway, you could use the concordance feature, and you can click on health, functional limitations. And you can see many of these questions. So difficulty walking across a room, dressing, bathing, eating, getting in and out of bed, or using a toilet, and which study these were asked in. So these kind of charts can be quite helpful for finding comparable measures across studies. We can see that these 6 ADLs are asked both in HRS and ELSA, so that's quite helpful. So it's a good place to find what's comparable across different studies. And then we're going to add a couple additional indicators. So I mentioned we're going to be looking at both birth cohorts. So we're going to need an indicator of when the individuals were born. And then I thought that we might also want to control for something. So in this case, we're just going to control for education level. So for instance, if we think that education level might have something to do with how quickly or when people develop a disability modeled as a difficulty with an ADL, then we might also think that, okay, well, younger birth cohorts might also have higher education. So we could control for that to really be able to parse out what's happening with birth cohort independent from changes in education by birth cohort. So from the range HRS data, we're going to use these variables listed on the bottom left here. So that includes a count of ADL difficulties. So this is actually a summary measure that's already created as part of the RAND HRS, which looks through 5 of those ADLs and counts them from whether they have 0, no difficulties with any of those ADLs, or 5 difficulty with every one of those ADLs. We also have a birth year, age, respondent analysis weight. There's a clustering variable and a stratum variable. We have an in-wave indicator also. And then from the harmonized HRS, we're going to use this harmonized education variable called RAEDUCL. So if you're wondering where, if you're not as familiar perhaps with these variables and what they might be named, there's 2 ways that I would suggest that you could find these. One is on the gateway, for instance. If we click back to surveys at a glance, we have this subtopic search. So for instance, we know for the HRS that we wanted analysis weights, and we wanted a birth date, and let's say we also wanted an education variable. And we could say we wanted that from the RAND HRS or the harmonized HRS, and we could search for that. And the search is going to really quickly give us those particular variables. So you can see we have a household analysis weight. We also have our person analysis weight. That's the one that we end up using from the HRS. And if we continue to scroll down, you can see some other different variables, including the birth month and birth year. So that's a place. And the other place I would suggest to go through is to just look at the code books. Each of the harmonized data sets are accompanied by a code book, and you can get access to the code books from that downloads page. So you could click this link here and get the RAND HRS code book or the harmonized HRS code book and look through that code book. And they're organized quite nicely, so you can just find, what are the variables around analysis weights, or what are the variables around birth year, and you can find those. So you could compile this list. So now we're going to actually start using Stata. And for a lot of this, I'm going to be switching in between both my slides and my Stata window itself. So here I'll bring up Stata, and I've got a do file that we're going to run here. And again, this do file I'll make available after the webinar for anyone else who wants to download it and run this on their own, or just use the code for their own purposes. So let's go back to our slides, where it's a little easier to see the code. So the first thing we're going to do is we're going to load the RAND HRS data. So we're going to, in Stata, use the use command, and we're going to list out the variables that we want to use. This is helpful because the RAND HRS is a really big data set. So we're not going to pull in every single variable that's created as part of the RAND HRS into Stata right now. Stata pulls the data into working memory. So we don't need to do that. We can just pull out those variables we want to use. So we're going to do that. And then we're going to merge in with the harmonized HRS variables. And in this case, just one harmonized HRS variable. Merging assumes that the observations that you're bringing into the data set could be matched with the observations that are already in the data set. And this is true between the RAND HRS and the harmonized HRS. So these are the same variables. So when we're going to say merge one to one, so they're both person level files. And this HHIDPN here is our unique identifier for HRS respondents. And you can see that everyone is matched, right? So there's no one that's in the RAND HRS that's not also in the harmonized HRS, and vice versa. And then the next thing we're going to do is we can just look at that education variable that I mentioned. That's part of the harmonized HRS. So you can see we have 3 levels of less than upper secondary and vocational education, and tertiary education. And if these seem a little strange, so these are actually made to be internationally equivalent. So in the United States, for instance, less than upper secondary means they didn't finish high school. upper secondary means they completed high school or they went to a vocational training, for instance. And tertiary means they had some kind of what we normally call in the US some kind of college level education. And generally this is having completed that. So we have that variable. We're also going to create a few additional variables. And in this case, we just need to create our cohort variable. So one of the variables that we read into memory was RAB year, and that's the respondent's birth year. And we're going to cut that up into 10-year birth cohorts. And we can do that using thisegen cut command. And if we do this inside of Stata, we can see that we're going to get 3 birth cohorts. So people who were born in 1920 to 1929, people born 1930 to 1939, and people born 1940 to 1949. And you can see that we have kind of a decent sample inside of the HRS for these people. You'll also notice that I've done this tabulation on the assumption that the person is in wave 6 and in wave 12. The HRS, there's going to be people who, for instance, because it's a longitudinal study, there's going to be people who are part of wave 1 and wave 2, and then maybe passed away or were lost to follow up for other reasons, and were never in this data set again. So in this case, we're just creating the assumption that this person was both interviewed at wave 6 and wave 12. So that's a limitation we placed on this tabulation. And then let's look at some wide data analysis. So there are ways to do longitudinal data analysis without having your data set in long format. And one of those ways is by calculating what is commonly referred to as a change score. And in this case, I'm going to make a change score between wave 6 and wave 12. So we're just looking at kind of like the beginning of our window at the end of our observation window. And this is just going to be a 0-1 indicator of whether the person, so only for people who started out at wave 6 with having no difficulties with any ADLs, that when we look at them again at wave 12, so they were again interviewed at wave 12, that they did have 1 or more. So you can see this in range. So R12 ADLA is 1 through 5. So they went from at wave 6 having none to by wave 12 having 1 or more. So we're kind of ignoring everything that happens in between. Often these change scores really just look at 2 time points. So we're going to make this change score. I'll jump over to Stata and we'll make that. And the next thing we're going to do is we're going to apply weights. I'm not going to spend a lot of time talking about weights because especially with longitudinal data, time doesn't permit it. And I'll also mention that not all studies release longitudinal weights. The HRS actually is one study that doesn't release longitudinal weights. ELSA, which we'll look at later, does use longitudinal weights. If you don't have longitudinal weights, for instance, it can sometimes be helpful to think about the direction of your analysis. So whether it's a prospective or retrospective analysis. If it's a prospective analysis, if you're looking at people who were interviewed at one time point and then looking at where they followed up, for instance, you might want to use, if you have just cross-sectional weights, use the weight from the baseline. And if it's a retrospective analysis, you might want to use the weight from the follow-up, because then you're kind of like looking backwards and seeing where those people were before. So some of it is just your kind of the direction of your analysis. In this case, I'm using the wave 6 weight. You can see here, I use SVY set, which is a way in Stata to declare complex survey design and weighting strategies, which Stata will remember for later commands. And we're going to enter the stratification and clustering variable that's part of the HRS data release. And we're going to use this wave 6 person level analysis weight. And we're also going to just create a sample variable. So we're going to generate a variable called sample1. And the requirement to be a part of sample1 is that you're in wave 6 and that you're in wave 12. So the first thing we can do is estimate what portion of people in our sample are going to develop a disability. So because, and this is developing a disability between basically under the assumption you don't have a disability in wave 6 and that, that you would develop one by wave 12. So you can do that in Stata using SVY, and that's going to recall in Stata what you said when you said SVY set. So it's going to recall your complex survey design, and it will also weight these appropriately based on the weight you specified in SVY set. And we're going to estimate the proportion of our change variable, our change score we created. And we're using proportion here because it's just a 0 or 1 for whether someone has it. It would be very similar to using mean also. Proportion has the advantage that it doesn't allow it to go below 0 because not more than 0% of a population can have developed a disability. So we can do that for our whole sample, and that's what we do here in the first line. And then in the second line, the second set of commands, we can estimate it kind of separately by birth cohort. And we can do that just using this over RAB cohort option on the end of that command. So if you look here inside of Stata, we can see that we can estimate the proportion of people who have developed a disability by wave 6. So that's of 1 here is around 18%. But we could also look at that by different birth cohorts. So this is the proportion that we would estimate would develop this disability for our different cohorts. And we can see that there are some differences by a cohort. So it looks like around 35% for people born in the 1920s, 19% for people born in the 1930s, and 10 or 11% for people born in the 1940s. We could also look at this in a chart, which makes it a little easier to see the difference. So one of the things that we're seeing is that we're estimating that people born earlier have a much more likelihood of developing this disability. And if we think about our data, and this is a longitudinal survey, and that we're looking over the same years for all of these people, this makes complete sense, right? So roughly the people in this 1920s category are going to be 10 years older than the people in the 1930s category, and 10 years older than the people, or 20 years older than the people in the 1940s category. So we know that age is influenced on when people start to develop a disability or a need for help, for instance. So this makes complete sense. We could also estimate this effect while controlling for the development of disability, estimate the effect of birth cohort on the development of a disability while controlling for education. I mentioned education might be something that we think could be kind of influencing both, might be different by both cohort, but also might be influencing the development of a disability itself too. For instance, if people with higher educations have more access or more resources, or perhaps more jobs that wouldn't be as physically demanding, they might be less likely to develop a disability. So we can do that. And so we're gonna use a logit regression in this case. And again, to recall in Stata what we had told it about our survey design, we can use this SVY set, and we're setting our subpopulation as sample 1, and we can run this logit. So what we can see in these regression results here is that, so our base case here, so these coefficients are relative to the group who was born in 1920s with a less than upper secondary education. So basically less than high school. So we can see that for people born later, we assume that they're less likely to develop a disability over time, which makes sense because they're older also, and we're looking over the same time frame for people of different ages. But also we can see that that's still true while controlling for education level. So education is not what's driving this difference. We can also see inside of education level that kind of my assumption that I put out there that people with higher education might be less likely to develop a disability is also true. So let's go ahead and reshape our data. Reshaping is not that complicated, but I find that it's something that can seem kind of different for people who are new to it. So reshaping in Stata is pretty simple. So you can use this reshape command. In this case, we're going to reshape long. And then we're going to go from our time varying variables, or in this case, wave varying, are going to be ADLA, R, ADLA, INW, and also this age variable, which we're going to use later on. We're going to specify that the HHIDPN, our unique identifier, identifies people. And then we're going to create a variable here in this J option, which is what are our repeated observations over, and in this case, they're waves. You also notice I have these @ symbols. So these @ symbols tell Stata that to treat whatever the number is in that @ symbol as the thing that we're iterating over our repeated observations. So that's what will feed into this wave variable. We can also then remove observations before and after our observation window. There's currently 13 waves of the HRS data available. So we're going to remove wave 13, and we're going to remove waves 1 through 5 also. And then we can define kind of a second sample. And in this case, what we're going to be looking to do, we're going to make a balance sample. And how we're going to do that is we're going to just only look at people who were interviewed at all 7 waves. So let's jump back over to Stata. I've added some output here just to help us visualize, which is sometimes helpful, this reshape command. So this is what our data looked like before. So we had each individual here as HHIDPN, and then we've got our people, our different time measures. So at wave 6, at wave 7, at wave 8, at wave 9, at wave 10. We reshape this data, and the result is, again, it's going to be a long format. So for each individual, we've got, we're going to have 1 through 13 observations. And then we've also got our RADL command variable, and this will have been copied over. So you can see that at wave 10, this first person here did have a 1 disability, and that was copied here this way. And then for all other waves, it was 0 difficulties with an ADL. We can also see this person wasn't interviewed at wave 1 and wasn't interviewed at wave 13, but we're going to drop those as we already did once we drop those observations, and then we're going to define our sample. So our sample is only going to be people who we have all 7 waves of data for. The next thing we're going to do is we're going to create an indicator of any ADL difficulty. So we're basically just simplifying that ADL variable, which is a count of difficulties with ADL, into a 0 or a 1. So whether you have any difficulty, whether you have any difficulty or no difficulty or any difficulty. And you can kind of just see how that works here. We use a recode command inside of Stata. So 0 will be left to 0, 1 through 5 will be counted, will be changed to a 1, and we make a new variable. And you can see, for instance, that for this person, for our first person here, they didn't have any difficulties ever, so they have a 0 always. But for the second person, they didn't have any difficulty at wave 1, and then, or at wave 6, but then at wave 7, they had 1 difficulty. At 8, they had 2. By 10, they had 3. But any ADL difficulty is just going to be a 0 or a 1. So it's just kind of a simplified indicator, which we can use later on. We can then estimate a prevalence of disability by wave. So again, we can use a proportion with our any variable because it's just a 0 or a 1 indicator. Under the condition of being part of sample 2, that means you were in a balanced sample, everyone was interviewed. And we can do that over our waves because our waves are now in long format. So let's look at that inside of Stata. So you can see here R1, so we get an estimate for wave 6, wave 7, wave 8, wave 9, wave 10, 11, and 12. You can look at that graphically, and one of the things that we see is that over these waves, we do see that people start to have a higher likelihood of having a disability, and disability modeled as having at least one problem with an ADL. We can also do that looking over wave and birth cohort. So kind of similar what we did to in the long format, but we're going to do this in the wide format, but we'll do this in the long format. This code is going to get much longer, but basically what we're going to do is we're going to have an estimation of this prevalence, so of the number of people who have this currently at each wave for each of our 3 birth cohorts. And we can look at that graphically. And so this is actually quite interesting. So some of the things that we see we would expect, right? So our blue line is our oldest age cohort. And that's the line that's going up the most. So these are the people who are most likely over the window of time that we're looking at here, of 2002 to 2014, most likely to have an increased prevalence. And then it goes down. And so people, for instance, born in 1930s and 1940s are less likely as they're younger. Also, interestingly, though, it looks like they kind of all start from the same place. So their estimates don't seem to be very different at wave 6 by birth cohort, but become really different later on once we get to wave 12. So one of the things we might be wanting to kind of disentangle is this difference between ages and time. And as I mentioned, one of the variables we kept in and that we put as part of our long data was age. So we could also estimate prevalence of disability by age. So we could do this here with a very similar proportion command. And we're only going to estimate it over the ages of 51 to 90. So the HRS sample focuses on people 51 and older. So we're going to limit that to that. And we're just going to say 90 so that we get a little bit of a cleaner looking graph and results. So if we do that inside of Stata here, so we're going to get an estimate for each. Let's scroll up a tiny bit. We're going to get an estimate for each age. So at age 50, 51, 52, 53. So this is going to be irrespective of the time at which people were actually this age, right? So we've kind of ignored our time element and we've just focused on the age element here. And if we look at this graphically, this looks like what we would expect. So our prevalence is generally stable until around age 70, and then it really starts to increase between 70 and 90. You will see that around 10% of our population we would estimate would have a disability between ages 51 and 70, but then between age 70 and 90, it's going to increase to close to 40% would develop a prevalence over this time period. We can also estimate it by disability and by age and birth cohort. And those are those long results that we saw here. So again, it's too much to look at probably this way, but basically we've got a result for many of our birth cohorts at different ages. And one of the things that's going to happen is we have people who are born at different times and we're looking at them inside of the same window. And so they're going to represent different ages, but there will be some overlap. And so this really allows us to be able to compare, for instance, years where there is overlap by birth cohort. So you can see here in a chart, which kind of illustrates this nicely. And this is a chart where I've limited these symbols to only where we have kind of 100 observations or more. So you can see for our oldest birth cohort, we kind of observe them in between 72 and 90. For our middle birth cohort, they're interviewed between 62 and 84, and our youngest birth cohort between 52 and 72 or 74. And this really is where we start to kind of disentangle this difference between time and age. So one of the things that you can see is that it does seem like that people who were born in the 1920s, that they actually are that they're at the same age, like say this comparable age of like 72, 73, 74, where we're able to observe all these birth cohorts, they're actually faring the best. So that would be maybe kind of counterintuitive to what we would think, which is that people would have less disabilities. Maybe they're healthier, they had better nutrition or better access in the past than people do most presently. But what we see is that they actually have lower rates of disability at that same ages. So this is a kind of an interesting thing where we get to disentangle that. And we can also kind of estimate that. So we can estimate this prevalence. Also, we could do that using a logit regression. So we can kind of, as we did before, we could use this logit regression to really parse out whether any of this is being driven by education, for instance. And once we run our logit regression, so again, our base group for a comparison here, and this is now by age, not by wave, is people who were born in the 1920s with less than a high school education. You can see that all of our coefficients here are significant, and that people who are indeed born later, born in later cohorts, are more likely to have a disability than in our 1920s cohort, which is quite interesting, and that's what we saw in that graph. You can also see that education works kind of the same way that we saw before, which is still people with higher education are less likely to develop a disability, or to have, I should say, to have a disability. When we want to talk about developing a disability, that's when we could talk about incidence. So I'm going to briefly just talk about incidence. We've been talking about prevalence, and prevalence is just the percentage of people or the proportion of the population who has that condition at any given time. Incidence, conversely, looks at when people develop that condition. So we're going to create this indicator of onset or development of a disability. And we can do that using some roughly simple Stata commands here. And so we're going to make this, I'll make this kind of incidence variable. And we're going to look just over our individuals. So HHIDPN, we'll sort over that. So we're not doing over anything between observations. And we're going to say we assume the incidence is 0 if at the wave before, so this is _n minus 1, it's 0. And then at the next wave, so 2 years later, at the next interview, it's also 0. And then we will give the incidence variable a value of 1 if at the wave before it was 0, and at the current wave, it's 1. So they've developed it. And we can actually look at what that looks like, which is perhaps a little easier. So you can see here for our first person, this person never develops any ADL difficulties. So both their prevalence and their incidence variables are always 0. For our second person, which we also saw before, you can see that they started out at wave 6 with no disabilities or no difficulties. They developed some, and they basically maintained them for the rest of our observation window. So the incidence variable, so the only time in which this individual could have not developed, could have developed a disability was at wave 7, where they didn't have one at wave 6. So you can see that they have a 1 value there for their incidence. You can also see in this third person, we have someone who at wave 9 had a difficulty and then it went away. And so you can see how that incidence variable gets made there. So when you're kind of making, especially these incidence variables that look across time, you kind of try to capture some of the time variation inside of a single variable. It's quite helpful to be able to look actually at what you're doing and how it might work. We can then estimate our incidence of disability by age. This is going to look really simple to what we did before. And we'll jump over and we can do that in Stata. So now instead of getting a prevalence, we get an incidence by age. And we can look at that graphically also. One of the things that you'll notice is that even though our sample is relatively the same, so these are all still people who were in a balanced sample, were interviewed every wave, our standard, our error bars here are much higher. And that's because if you remember, there's going to be lots of people who, once you develop a disability, we can't test whether you're going to, you can't redevelop, I mean, you can redevelop later on if you don't have it, but we're not looking at kind of accumulation or increase in the intensity of your disability. It's just a 0 or 1. So in some sense, we have less observations, which results in higher standard errors. But the other thing that we can see is that we do still see a gradient increase. So especially around the ages of 75 to 77, 78 is when we start to see a real increase in people starting to have their first difficulty with disability, which we're with an ADL, which we're taking as disability incidence. And we can also do this similarly also by birth cohort. So we're using a low-jet regression here, and we're controlling for education, and we're controlling for birth cohort also. So let's look at that inside of Stata. So one of the things that you'll see, even looking at incidence, is that although less significant, the difference between this 1930s group, between the 1920s and 1940s birth cohorts, we do see a higher coefficient for people in the 1940s group, suggesting that they have higher rates of incidence than people who were born in the 1920s. And we still see it, and this is while controlling for education, which we know decreases it. So I think that's kind of an interesting finding. So that's part one. So part two, we're basically just gonna think about how to merge in our data, and then we'll do just two quick analyses. So we're gonna bring in this ELSA data. So the first thing we're gonna do is we're gonna just save our HRS data where we are. We're gonna download the harmonized ELSA. We're gonna load it into Stata. We're gonna identify our relevant ELSA variables. We're gonna create some additional variables. We're gonna do a long data prevalence estimation just on ELSA, just to see, you know, maybe visually if we notice a difference between what we saw for the US. And then we can actually do a cross-country regression where we could kind of test that difference that we might have observed. So to save the HRS data, so we've got it in kind of Stata working memory right now, we can just create what's called a temp file in HRS. So it's going to go away as soon as this program starts running, basically. We're going to call it HRS, and we're going to save it and clear out Stata. And so once we've downloaded the ELSA data set, and that's available on the UK data service, and again, you can find that link on the Gateway to Global Aging Data. You would then want to identify your relevant variables. Looking over the same years of interest of 2002 to 2014, that's ELSA waves 1 through 4. And ELSA is going to have a lot of the same variables. And although we're not going to use weighting in this situation because it's a little more complicated because it's a cross-study weighting, and ELSA provides a longitudinal weight, which HRS doesn't, so it's something that you want to think about. I have included here in this slide what are the cross-sectional and longitudinal weights which are provided by ELSA, which are really quite helpful. Then we can load our ELSA data set. Unlike the HRS that had the RAND HRS and the harmonized HRS, ELSA just has one harmonized data file, core data file called the harmonized ELSA. So we can specify that. We also make a cohort variable just the same way we did before. And if we tab that by people who were in wave 1 and wave 7, so just like we did for the HRS, you can see that we do have a smaller sample. You know, it's not too small, but it is a smaller sample of people born in the 1920s. So that's important to think about the representation inside of these longitudinal studies, especially by age. So the HRS started quite a bit earlier than the ELSA. So they already had some older people that they were able to continue to follow by the time they were observed in our window of HRS, starting at HRS wave 6. And so at ELSA, at wave 1 and wave 7, they have less of those people. But we do, it's a decent sample size, and it's not distributed in a way that I'm going to worry about for this sample presentation anyway. Now we're going to reshape that data. It's going to look exactly how we reshaped the HRS data. And then we can remove any observations for later waves. So there's a wave 8 of ELSA. We're going to drop that wave 8 variables. And then we can also define our samples. This is kind of our balanced sample of people who were in all 7 waves that we were looking at. And we're going to call that sample 2, just as we did before. We'll then create our indicator of any ADL difficulty, same way we did before. And then we can estimate our prevalence of disability by age and birth cohorts. And we'll do that just for ELSA. So again, we're going to use this prevalence indicator. We're not going to look at incidence here because we already have a smaller sample size. So let's just think about prevalence. So we'll do the proportion of our prevalence variable only if it's a balanced sample, so only if it meets the condition of being part of sample 2. And we're gonna limit it to the ages of 50 to 90. So the ELSA sample is slightly different than the HRS sample, which is it runs from age 50 and older. Also, ELSA will top code people who were older than 90. So it's quite hard to get estimates unless they were already in the sample for people who were older than 90. And we can do that by our ages and by birth cohort. So if we look at that graphically, our standard errors are a little larger than we saw. Then our error bars are larger than we saw with the HRS data, but it does look like there's less cohort difference the way I'm looking at it. And certainly doesn't seem to be a significant cohort difference. So you do see a gradient from 52 here to 90. But looking at those ages where the cohorts are quite similar, again, around like 70 to 75, there doesn't seem to be a lot of cohort difference. The next thing we can do is we're going to work on combining back our HRS data, which we've saved. So we're going to make just a few adjustments. So we're going to, if you remember, the HRS age variable was called AGEY_E. So we're just going to rename our ELSA variable to keep it comparable. And then we're going to append our saved HRS data. So when we combined the RAND-HRS and the Harmonized HRS data, we used the merge command. And that assumed that there were observations which could be repeated in both the RAND-HRS and Harmonized HRS. And in fact, they all were. Append makes the assumption that the observations are not similar between any of them. And it basically is going to put the new data, in this case, the HRS data, below all of our ELSA data. And we can also generate an indicator of where that data came from. We'll call that variable country, and we can give it a value of 0 for England if it was already in the data set. And if it was just appended, we know it's from the US because it's from the HRS. So we'll call that, we'll give that a value of 1 for the United States. Then we can also generate a universal ID. So if you remember, the ID variables between the HRS and ELSA were different. And so we can just use this kind of quick command in Stata, which is an egen group command with an option to allow for missings to create our universal ID variable. The next thing we will want to do is we're going to remove observations with repeated ages. And let's actually look at what's happening here in the data. So let me jump down in Stata at this point. So there are going to be some cases where the data is repeated, ages are repeated. And let's look at some of those cases. So for instance, age is occasionally self-reported in these data sets. So it could be that a person here in the HRS data, they say at both wave 11 and wave 12, they self-reported that they were 81. So that's probably a mistake. And for this analysis, where we really want to look over different ages, we're just going to drop that. As I mentioned, also, ELSA kind of top codes age at 90. So we're going to have people who are top coded in ELSA here at 90. So from wave 6 on, this person is always going to look like they're 90, and of course they're not. So because we really can't differentiate over these different ages, we're just going to drop these people. So you can see here we drop if repeats, and so we drop 793 observations. And I don't quite remember how many people that is, but most people, most observations, this isn't an issue for. And the last estimation that we're going to do is we're going to do a random effects estimation. So far, we really haven't. We've kind of done kind of regular estimation techniques, not necessarily longitudinal estimation techniques, but using a fixed or random effect or a mixed effects model, for instance, really allows you to look over the individual, what's happening over time. These estimation techniques also can be helpful because they don't require that someone is interviewed at every single wave, for instance. And in the case of looking across age, of course, we don't have people at every ages. Most of these surveys are every 2 years. So to use this random effects model inside of Stata, the first thing we're going to do is use our xt_set command. So we're going to tell Stata what is our ID variable, how do we identify our observations over which we're going to look the change inside of. And then what is our time varying variable? And so that in this case, we're going to use AGEY. And again, because we think age is probably, you could also do wave here, but I think that age is going to be tell us something more interesting about what's happening in disability by age. And then we're going to use a logit command because we're still going to look at this, whether they have any variable. That's what we used to estimate prevalence before. And this xt commands uses going to be the panel data command. So a panel data logit basically. You can see I have this option here for RE, so random effects. You could also use fixed effects. And I'm not going to get into the differences or the right strategies for this. I just want to kind of give you an idea of how you might set up the data for any of these, and that's how you've done this here. And then we're going to look over our ages. We're going to control for education. And then we're also going to look at our birth cohorts, but we're going to interact that with country. So we can look separately at the effect of birth cohorts for ELSA and for England and the United States and see if we see a difference. So let's look at that result once that logit command is done. So this is what our results are going to look like. You can see that, so our coefficient on age is positive and it's significant, which is what we'd assume, right? There's more likelihood of you having any difficulty with an ADL at greater ages. If you remember, we've controlled for the interaction between birth cohort and country. So our base group for comparison here are people who were born in the 1920s in England with a less than lower secondary education. So we've controlled for education, and that's really less of the point. And I think the more interesting statistics here are this RAB cohort variable. And so as you can see to the bottom here, these are the cohort variables for the United States. So these represent for England. And you can see we don't see a significant difference between 1920s and 1930s, but we do, even for England, see a significant difference between 1940s. Overall, already controlling for cohort specific differences between countries, the United States, they still have less likelihood of having difficulty with an ADL. And then inside of the United States, we can also see what we saw before, which is that, although not significant here, the 1940s group has a higher, a positive and higher coefficient of having that disability. So that's going to kind of wrap up our sample analysis. I'm happy to stay on here as long as anyone likes and answer questions. I'll also mention that we have a help desk. So if you are getting started with using these data sets or wondering, for instance, what variables there are available, and if the thing that you're looking to study, is it available in these studies? And if so, how is that variable structured? You can always email us. We have a whole team of people who work on this project, the Gateway. And you can email us at help@g2aging.org. Otherwise, the slides, as I mentioned, the slides, the Stata code that I used today, and the recording of today's webinar will be available on the Gateway website. And that will be, I'll tell you when, this should be available. Usually we get it posted within 24 hours. And that will be available on this documentation tab. So you can see here we have recent presentations. So this one will come up first. So I'm happy then to take questions. Himanshu, I'm just going to mark this, answer this live, asked when to use fixed effects and random effects in panel analysis. Whether to use fixed or random effects really depends on what you're trying to estimate and whether it's time varying or not. For instance, I would say it's going to really depend on what you're looking at. There's a lot of great resources. I can include them on an additional slide here for knowing about when to use fixed or random effects in longitudinal or panel analysis. But it really depends on what your research question is. So what's the thing you're trying to analyze, and then what do you believe about how it changes? So for this example, I ended up using a random effects module, and that's because I was really interested in this difference between different birth cohorts and country. So to be able to get an estimate between these different individuals who are in different birth cohorts and country, I need to use a random effects model. I'll also just mention when talking about different longitudinal techniques. So there are other ones besides these. As I mentioned, there's also there's mixed effects models, and some of them do a really nice job, especially of dealing with missing data, which can be really helpful. We did utilize that here because, of course, we don't have people at every age. But it's one of the advantages of using this data in long format with Stata. Junaid Khan asks, how the attritions are dealt with while analyzing HRS data, or is there any problem of attrition at all? Yes, HRS, like all studies, definitely has attrition. That is one of the, and attrition can be due to a couple of reasons, right? Attrition could be in some ways because they died, so they're no longer part of the panel. It could also be because they were lost to follow-up. For instance, they moved or they decided just not to be part of the HRS. Dealing with attrition is really one of the reasons that having a longitudinal weight variable is really helpful, because that is basically going to account for who ended up attriting the sample over that given time period. So for instance, that's what ELSA's longitudinal variable accounts for, the longitudinal weight variable, is that it accounts for attrition between waves. One of the things, especially in the way that we did this, that you would really want to think about is the weight variable we used was for anyone who was part of wave 6, and then we limited that to wave 6 and also in wave 12. But there's going to be like a lot of people who didn't make it to wave 12 for these different reasons we've been talking about. So you could also look at those people and at baseline, were they different? So that's one way to kind of think about this, but the best way to deal with this kind of the effect of attrition when using a longitudinal sample is to have a longitudinal weight, as ELSA provides. Janan, let me know if I didn't quite answer your question. I think that I was able to answer that. And Yin Lu says, thank you for the presentation. Thank you. I had a question about cross comparison of effects. When you look at differences between HRS, ELSA, and TILDA, instead of append data from 3 national studies, is it appropriate to just run analysis within each study and then just compare the patterns of association in each of the national studies? So yes, so that's really commonly done, and you can absolutely do that, right? So you can, just like we did here, I ended up kind of combining ELSA and HRS data into one data set, but we could have just run this analysis for HRS and for ELSA. The thing that, that you won't be able to do if you have them in their separate data sets is you won't really be able to test that difference. So controlling for those things that are similar between the studies, testing the difference between the cross-study or cross-country difference. So if testing that difference, testing that cross-country difference is important to you, that's when you want to create this kind of pooled data set with observations and variables from different studies. But if, for instance, you're just interested in looking at, you know, for instance, a prevalence or an incidence estimation between different countries and just showing those comparatively beside each other, then you certainly don't need to combine them into one data set. Also, thank you. I'm glad that you enjoyed the presentation. If there are presentations that you would like to hear from the Gateway team in the future, focusing on different types of survey analysis that might be done with these HRS data sets, whether like more complicated or maybe less complicated, or, you know, I looked here at disability, I really focused on disability. If there's another research domain which is of interest, I would encourage you to just email our help desk, and we're certainly happy to take advice. You know, we want to tailor these webinars to what people find interesting. So please let us know if there's additional webinars we could do that would be of interest to you. And Yin Lu asks, my model is quite complicated, multi-level mediation analysis. Can you please comment on how cross-national comparison can be done in this type of analysis? So you're right that the more complicated your analysis is getting, and especially if there's levels inside of each country, it becomes harder to do with a pooled analysis. I think I can't give any advice specific to what you're doing without knowing more. And even if I did, you might know more about your topic and the research techniques. But I think it's probably worth exploring again if the purpose of your analysis is really to test whether there are cross-country differences or what might be driving those cross-country differences, then it's quite important. I'm sorry I'm not able to give maybe a more direct answer on that, but a lot of it just depends on what you're doing and how you're doing it. And there's so much to know about, even just using Stata for longitudinal research and analysis. So it can get quite complicated. I'm happy to take other questions if there are any. Okay, well, barring any additional questions, maybe we just have one. Yes, someone said, thank you. And are you going to send the recorded presentation? I probably will not actually send it, but you can find it within 24 hours on our website, and you can download it from there. I just don't quite want to spam too much in case people don't want the presentation, but it will be, I assure you, it'll be available again on the documentation page of the gateway. So it'll be here, and we'll have the slides, the Stata code, and the video. So that'll be available within 24 hours. All right, well, assuming there are no follow-up questions, again, thank you. Thank you for joining. I hope this was helpful and informative and kind of encouraged you maybe give you some nice direction for your future or upcoming or potential research using the Gateway and the resources and the HRS family of studies. I hope you all have a wonderful day.